Introduction to Bloodborne Pathogens. Bloodborne pathogens, BBPs, are microorganisms present in human blood that can cause disease in humans. Understanding these pathogens is crucial for maintaining a safe environment in various professional settings. This course will equip individuals with the necessary knowledge to identify risks and implement effective control measures. Protecting oneself and others from potential exposure is a primary responsibility in many workplaces. Adherence to safety protocols not only prevents disease, but also ensures compliance with regulatory standards. The information presented here is vital for anyone who may encounter blood or other potentially infectious materials. The goal of this certification is to provide a foundational understanding of bloodborne pathogens and the practices required to prevent their transmission. This includes recognizing the types of pathogens, how they spread, and the specific precautions to take. By completing this course, participants will be better prepared to respond to potential exposures and minimize risks. This knowledge is essential for healthcare workers, first responders, and anyone in professions where contact with blood is possible. Ultimately, this training aims to foster a culture of safety and vigilance. What are bloodborne pathogens? Bloodborne pathogens are infectious microorganisms found in human blood that can cause disease. These pathogens can be transmitted through contact with contaminated blood or other potentially infectious materials, OPIM. Examples of OPIM include semen, vaginal secretions, cerebrospinal fluid, synovial fluid, pleural fluid, pericardial fluid, peritoneal fluid, amniotic fluid, saliva in dental procedures, and any body fluid visibly contaminated with blood. Understanding the specific nature of these pathogens is the first step in effective prevention. They pose a significant health risk if proper precautions are not followed. Exposure can lead to serious, life-threatening illnesses. The primary concern with bloodborne pathogens lies in their ability to survive outside the human body for varying periods and infect new hosts. This makes environmental surfaces and contaminated sharps a significant hazard. Common routes of transmission include accidental needle sticks, cuts from contaminated objects, contact with open wounds, and mucous membrane exposure. It is important to remember that even dried blood can harbor viable pathogens under certain conditions. Therefore, all blood and OPIM should be treated as infectious, regardless of perceived risk. This principle forms the basis of universal precautions. Common bloodborne pathogens. HIV, human immunodeficiency virus, HIV, is a bloodborne pathogen that attacks the body's immune system, specifically CD4 T cells. Over time, HIV can destroy so many of these cells that the body cannot fight off infections and diseases, leading to acquired immunodeficiency syndrome, AIDS. HIV is primarily transmitted through specific body fluids, blood, semen, preseminal fluid, rectal fluids, vaginal fluids, and breast milk. It is not spread through casual contact like hugging, shaking hands, or sharing food. Understanding these transmission routes is critical for preventing its spread. While there is no cure for HIV, effective antiretroviral treatments can manage the virus and prevent progression to AIDS. Early diagnosis and treatment are vital for affected individuals. In occupational settings, the primary concern for HIV transmission is through percutaneous exposure, such as needle sticks or cuts from contaminated sharp objects. Mucous membrane exposure, like splashes to the eyes, nose, or mouth, also poses a risk. Intact skin is generally an effective barrier against HIV. However, contact with non-intact skin, e.g., skin with dermatitis, abrasions, or open wounds, can also lead to transmission. Following strict universal precautions, including proper handling of sharps and consistent use of personal protective equipment, significantly reduces the risk of occupational HIV transmission. Education and awareness are key components of prevention strategies. Common bloodborne pathogens: hepatitis B, HBV. Hepatitis B virus, HBV, is a bloodborne pathogen that causes inflammation of the liver, a condition known as hepatitis. HBV can lead to both acute and chronic liver disease, including cirrhosis and liver cancer. It is transmitted through blood and other body fluids, similar to HIV, but is significantly more infectious. Common transmission routes include percutaneous exposure, for example, needle sticks, sexual contact, and from an infected mother to her baby during birth. HBV can survive outside the body for at least 7 days, remaining capable of causing infection. This extended viability makes environmental surface contamination a particular concern. Vaccination is the most effective way to prevent hepatitis B infection. A hepatitis B vaccine is highly effective and safe, offering long-term protection against the virus. It is typically administered in a series of 3 doses. Many employers are required to offer the hepatitis B vaccination series to employees who have occupational exposure to blood or OPIM. Post-exposure prophylaxis, PEP, is also available for unvaccinated individuals after potential exposure, but it's most effective when administered promptly. Regular testing and awareness of one's HBV status are important for both personal health and preventing further transmission. Adhering to universal precautions remains paramount in all settings to minimize exposure risks. Common bloodborne pathogens: hepatitis C, HCV. Hepatitis C virus, HCV, is another bloodborne pathogen that primarily targets the liver, causing hepatitis. Unlike HBV, there is currently no vaccine available for hepatitis C. HCV infection can range from a mild illness lasting a few weeks to a serious, lifelong condition that can lead to cirrhosis, liver cancer, or liver failure. The primary mode of transmission for HCV is through contact with infected blood, most commonly through sharing needles or other drug injection equipment. Less common routes include sexual contact, mother-to-child transmission, and needle stick injuries in healthcare settings. Many people with chronic HCV may not experience symptoms for decades, making early detection challenging. Due to the lack of a vaccine, prevention of HCV relies heavily on avoiding exposure to infected blood. This includes strict adherence to universal precautions, especially in healthcare and other occupational settings where contact with blood is possible. Safe injection practices, proper sterilization of medical equipment, and thorough cleaning of contaminated surfaces are crucial. For individuals with HCV, treatment options have significantly advanced, with many antiviral medications now capable of curing the infection. However, preventing initial infection remains the most effective strategy. Regular screenings of at-risk populations is also an important public health measure. Transmission routes of BBPs. Bloodborne pathogens are transmitted when infected blood or other potentially infectious materials, OPIM, enter the bloodstream of another person. The most common transmission routes include percutaneous injuries, such as needle sticks or cuts from contaminated sharp objects. These injuries create a direct pathway for pathogens to enter the body. Mucous membrane exposure, which occurs when infected fluids splash into the eyes, nose, or mouth, is another significant route. Non-intact skin exposure, where infected fluids come into contact with skin that has cuts, abrasions, dermatitis, or other lesions, also poses a risk. Intact skin generally acts as an effective barrier against BBPs. Indirect transmission can also occur when an individual touches a contaminated surface or object and then touches their eyes, nose, mouth, or an open wound. While less common, this route highlights the importance of environmental decontamination and hand hygiene. Sexual contact is a known route for HIV, HBV, and HCV transmission. Mother-to-child transmission during pregnancy, birth, or breastfeeding is another critical route for these pathogens. Understanding these diverse pathways is fundamental to developing effective prevention strategies. Each route requires specific control measures to minimize the risk of infection. Occupational exposure risks. Occupational exposure to bloodborne pathogens refers to a reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or other potentially infectious materials, OPIM, that may result from the performance as an employee's duties. Healthcare workers, emergency responders, laboratory personnel, and even housekeeping staff are at elevated risk. Accidental needle sticks are among the most common and dangerous forms of occupational exposure. Cuts from contaminated broken glass or other sharp instruments also pose significant threats. Any situation where there is a potential for contact with blood or OPIM must be recognized as an exposure risk. Vigilance and adherence to safety protocols are paramount. The risk of infection after an occupational exposure depends on several factors. These include the pathogen involved, the type of exposure, e.g., deep needle stick versus skin splash, the amount of blood involved, and the viral load of the source individual. For example, the risk of HIV transmission from a single needle stick is relatively low, while the risk for HBV is significantly higher if the source is infected and the exposed person is unvaccinated. Proper training, consistent use of personal protective equipment, PPE, and immediate post-exposure procedures are crucial for mitigating these risks. Employers have a responsibility to minimize occupational exposure through engineering and work practice controls. Universal precautions. Definition. Universal precautions is an approach to infection control where all human blood and certain human body fluids are treated as if known to be infectious for HIV, HBV, HCV, and other bloodborne pathogens. This means that healthcare workers and others who may come into contact with blood or OPIM should always use protective measures, regardless of whether they know the source individual's infection status. The core principle is to assume that every patient or individual is potentially infectious. This approach eliminates the need to identify specific individuals as infectious, simplifying safety protocols. It is a fundamental strategy for preventing occupational exposure to bloodborne pathogens. The concept of universal precautions was introduced by the Centers for Disease Control and Prevention, CDC, in 1985, primarily in response to the HIV/AIDS epidemic. It was later expanded and integrated into what is now known as standard precautions, which includes precautions for all body fluids, secretions, and excretions, except sweat, regardless of whether they contain visible blood. However, the core tenets of treating all blood and OPIM as infectious remain central. Implementing universal precautions consistently is crucial for protecting workers and patients alike. It forms the bedrock of modern infection control practices in many industries. Universal precautions. Practicing universal precautions involves consistently applying infection control measures to prevent exposure to bloodborne pathogens. This includes the routine use of personal protective equipment, PPE, such as gloves, gowns, masks, and eye protection whenever contact with blood or OPIM is anticipated. Proper hand hygiene, including thorough hand washing with soap and water or using an alcohol-based hand rub, is essential before and after contact with patients and after removing PPE. Safe handling and disposal of sharps, such as needles and scalpels, are also critical components. These practices are not optional. They are mandatory for safeguarding health. Environmental controls are another vital aspect of universal precautions. This involves cleaning and decontaminating surfaces and equipment that may have been contaminated with blood or OPIM. Using appropriate disinfectants and following established cleaning protocols helps to eliminate pathogens from the environment. Proper waste disposal procedures for contaminated materials are also crucial to prevent further spread. Training and education for all personnel are necessary to ensure consistent application of these practices. By integrating these measures into daily routines, workplaces can significantly reduce the risk of bloodborne pathogen transmission and create a safer environment for everyone. Personal protective equipment, PPE. Personal protective equipment, PPE, is specialized clothing or equipment worn by an employee for protection against hazards. In the context of bloodborne pathogens, PPE acts as a barrier to prevent skin, mucous membrane, and clothing exposure to blood and other potentially infectious materials, OPIM. Common types of PPE include gloves, gowns, masks, and eye protection, such as safety glasses or face shields. The selection of appropriate PPE depends on the anticipated exposure. For example, a simple glove may suffice for routine blood draws, while a full gown, mask, and face shield might be necessary for procedures involving splashes or sprays. Proper use of PPE is critical for its effectiveness. It is essential to know how to properly don, put on, and take off PPE to prevent self-contamination. PPE should be removed immediately after use and disposed of in designated containers. Never reuse disposable PPE. Employers are responsible for providing, maintaining, cleaning, and disposing of PPE, as well as ensuring employees are properly trained in its use. Regular inspection of PPE for damage or defects is also important. Consistent and correct use of PPE is a cornerstone of bloodborne pathogen safety, significantly reducing the risk of occupational exposure and infection. Training programs must cover the specific types of PPE used and the correct procedures for each. Hand hygiene and sharp safety. Hand hygiene is one of the most effective ways to prevent the spread of infections, including bloodborne pathogens. This involves washing hands thoroughly with soap and water for at least 20 seconds, especially after contact with blood or OPIM, after removing gloves, and before and after patient contact. When soap and water are not available, an alcohol-based hand rub with at least 60% alcohol can be used, provided hands are not visibly soiled. Proper hand hygiene removes transient microorganisms and significantly reduces the risk of pathogen transmission. It is a simple yet profoundly impactful practice in infection control. Regular training reinforces its importance and correct technique. Sharp safety is paramount in preventing percutaneous injuries, which are a major route of bloodborne pathogen transmission. This includes using safety-engineered devices whenever possible, which incorporate features to prevent needle sticks or cuts. Never recap, bend, or break contaminated needles by hand. Always activate the safety feature on safety devices immediately after use. Dispose of all used sharps in designated, puncture-resistant, leak-proof, and closable sharps containers. These containers should be located as close as possible to the point of use and should never be overfilled. Following these strict sharp safety guidelines is essential for protecting workers from preventable injuries and exposures. Housekeeping and decontamination. Effective housekeeping and decontamination procedures are critical for maintaining a safe environment and preventing the spread of bloodborne pathogens. All surfaces, equipment, and other items that have been contaminated with blood or other potentially infectious materials, OPIM, must be thoroughly cleaned and decontaminated. This includes work surfaces, floors, walls, and reusable equipment. A written schedule for cleaning and decontamination should be established and followed, outlining the methods, frequency, and appropriate disinfectants to be used. Regular cleaning reduces the overall microbial load and eliminates potential reservoirs for pathogens. It is a proactive measure to protect both staff and patients. The selection of disinfectants is crucial. They must be EPA registered and effective against HBV, HIV, and other relevant pathogens. Follow the manufacturer's instructions for dilution, contact time, and safe handling of disinfectants. Personal protective equipment, PPE, must be worn during cleaning and decontamination procedures to prevent exposure. Contaminated broken glassware should be picked up using mechanical means, such as tongs or a dustpan and brush, never by hand. Proper disposal of all contaminated cleaning materials is also essential. These meticulous housekeeping practices are fundamental to breaking the chain of infection and ensuring a sterile environment. Waste disposal procedures. Proper disposal of contaminated waste is a critical component of bloodborne pathogen control. Regulated medical waste, often referred to as biohazardous waste, includes any waste that poses a risk of infection to humans. This typically includes items saturated or dripping with blood, pathological waste, and sharps. All regulated waste must be placed in appropriate containers that are closable, leak-proof, and labeled with a biohazard symbol. These containers should be kept upright to prevent spillage and should be easily accessible to personnel. Following strict disposal protocols prevents environmental contamination and protects waste handlers. Sharps waste, such as needles, scalpels, and broken glass, requires specific disposal in puncture-resistant containers. These sharps containers must also be labeled with a biohazard symbol and should not be overfilled. Once full, they must be sealed and disposed of according to local, state, and federal regulations. Non-sharps regulated waste should be placed in red biohazard bags or containers. Proper segregation of waste at the point of generation is essential to avoid mixing hazardous and non-hazardous materials. Training on waste classification and disposal procedures is mandatory for all employees who handle such materials, ensuring compliance and safety. Exposure Control Plan, ECP. An Exposure Control Plan, ECP, is a written program designed to eliminate or minimize occupational exposure to bloodborne pathogens. OSHA, Occupational Safety and Health Administration, requires employers whose employees may be exposed to blood or OPIM to establish such a plan. The ECP must be accessible to employees and reviewed and updated at least annually, or whenever new procedures or tasks affect occupational exposure. Key components of an ECP include exposure determination, the schedule and methods of implementation for various control measures, and procedures for evaluating exposure incidents. It serves as a comprehensive guide for workplace safety. The ECP must detail engineering controls such as sharps disposal containers and needleless systems, and work practice controls like hand hygiene and safe handling of sharps. It also outlines the provision and use of personal protective equipment, PPE, housekeeping procedures, and waste disposal protocols. Furthermore, the plan must include provisions for hepatitis B vaccination, post-exposure evaluation and follow-up, and communication of hazards to employees. Training requirements and record-keeping procedures are also integral parts of the ECP. A well-developed and consistently implemented ECP is essential for protecting employees and ensuring regulatory compliance. Post-exposure procedures. In the event of an occupational exposure to blood or other potentially infectious materials, OPIM, immediate action is crucial. The first step is to wash the exposed area thoroughly with soap and water. If the exposure involves mucous membranes, eyes, nose, mouth, flush with water or saline for at least 15 minutes. Report the incident immediately to your supervisor and follow your facility's established exposure control plan. Prompt reporting is essential for initiating timely medical evaluation and follow-up. Do not delay seeking medical attention, as time is a critical factor in the effectiveness of post-exposure prophylaxis, PEP. Following initial first aid and reporting, a confidential medical evaluation will be conducted. This typically involves identifying the source individual, if known, and testing both the source and the exposed employee for HIV, HBV, and HCV. Counseling will be provided regarding the risks of infection and the availability of post-exposure prophylaxis, PEP. PEP medications, particularly for HIV, are most effective when started within hours of exposure. Ideally, within 72 hours. The exposed employee will receive follow-up medical care, including repeat testing and monitoring for potential infection. All medical evaluations and treatments must be provided at no cost to the employee and remain confidential. Understanding these steps can reduce anxiety and improve outcomes. Hepatitis B vaccination. The hepatitis B vaccine is a highly effective and safe way to prevent hepatitis B virus, HBV, infection. It is recommended for all individuals who have occupational exposure to blood or other potentially infectious materials, OPIM. The vaccine is typically administered in a series of 3 intramuscular injections over a 6-month period. After completing the series, most individuals develop protective antibodies against HBV. This vaccination is a crucial engineering control measure mandated by OSHA for at-risk employees. It provides a significant layer of protection against a common and potentially severe bloodborne pathogen. Employers are required to offer the vaccine at no cost to employees. Employees have the right to accept or decline the hepatitis B vaccination. If an employee declines, they must sign a declination form, acknowledging that they have been offered the vaccine and understand the risks of not being vaccinated. However, employees can change their mind and receive the vaccine at a later date if they remain at risk. Post-vaccination serologic testing may be recommended for certain individuals to confirm immunity. It is important to note that the hepatitis B vaccine does not protect against other bloodborne pathogens like HIV or HCV. Therefore, universal precautions must still be consistently followed, even by vaccinated individuals, to prevent exposure to all bloodborne pathogens. Record keeping and training. Accurate record keeping is a vital aspect of an effective bloodborne pathogen program. Employers are required to maintain several types of records. These include medical records for each employee with occupational exposure, which must be kept confidential, and maintained for the duration of employment plus 30 years. Training records, documenting the dates of training, content, names of trainers, and attendees, must be maintained for 3 years from the date of training. Additionally, Sharp's injury logs must be maintained for 5 years, detailing the type and brand of device involved, the department or work area, and an explanation of how the incident occurred. These records are crucial for monitoring effectiveness and compliance. Comprehensive training is essential for all employees who have occupational exposure to bloodborne pathogens. Training must be provided at the time of initial assignment to tasks where occupational exposure may occur, and at least annually thereafter. The training must cover the employer's exposure control plan, epidemiology and symptoms of bloodborne diseases, modes of transmission, use of universal precautions, selection and use of PPE, hepatitis B vaccination, emergency procedures, and post-exposure evaluation. Training must be interactive and allow for questions and answers. Effective training ensures employees are knowledgeable and prepared to protect themselves and others, fostering a culture of safety and accountability. Employer and employee responsibilities. Employers have significant responsibilities under OSHA's Bloodborne Pathogens standard. They must establish a written exposure control plan, ECP, and ensure it is accessible to employees. This includes providing all necessary personal protective equipment, PPE, at no cost, ensuring its proper use, and maintaining it. Employers are also responsible for implementing engineering and work practice controls, such as providing sharps disposal containers and ensuring proper housekeeping. Offering the hepatitis B vaccination series at no cost to at-risk employees is another key responsibility. Furthermore, employers must provide post-exposure evaluation and follow-up to exposed employees, also at no cost. These duties are legally mandated to protect workers. Employees also have critical responsibilities in preventing bloodborne pathogen exposure. They must comply with all aspects of the employer's ECP, including using engineering and work practice controls. This means consistently utilizing PPE when required, practicing proper hand hygiene, and safely handling and disposing of sharps. Employees must report all occupational exposures immediately to their supervisor. Participating in required training programs and understanding the risks associated with bloodborne pathogens are also essential. By actively engaging in safety practices and adhering to established protocols, employees play a vital role in protecting themselves and their colleagues. Safety is a shared responsibility that requires active participation from everyone. Legal and ethical considerations. The prevention and management of bloodborne pathogens are governed by significant legal and ethical considerations. OSHA's Bloodborne Pathogen Standard 29 CFR 1910-1030 is the primary federal regulation in the United States, mandating specific requirements for employers to protect workers. Violations of this standard can result in substantial fines and legal penalties. Beyond federal law, state and local regulations may impose additional requirements. Ethically, healthcare professionals and others with potential exposure have a moral obligation to protect themselves and prevent the transmission of pathogens to patients and colleagues. This includes practicing universal precautions diligently and reporting exposures promptly. Adherence to these standards reflects a commitment to public health and safety. Confidentiality is a critical ethical and legal consideration, especially concerning the HIV, HBV, or HCV status of both source individuals and exposed employees. Medical records related to exposure incidents and post-exposure follow-up must be kept strictly confidential, in accordance with HIPAA, Health Insurance Portability and Accountability Act, and other privacy laws. Discrimination against individuals with bloodborne pathogen infections is illegal and unethical. Employers must ensure a non-discriminatory environment and provide reasonable accommodations if needed. Balancing the need for infection control with patient and employee rights to privacy and non-discrimination is a complex but essential aspect of managing bloodborne pathogens. Ethical practice demands respect for all individuals while upholding public health standards. Conclusion and certification. This course has provided a comprehensive overview of bloodborne pathogens, covering their nature, common types like HIV, HBV, and HCV, and their transmission routes. We have explored the critical importance of universal precautions, proper use of personal protective equipment, PPE, and essential practices such as hand hygiene and shot safety, effective housekeeping, waste disposal procedures, and the implementation of an exposure control plan, ECP, are fundamental to preventing occupational exposures. Understanding post-exposure procedures and the role of hepatitis B vaccination further empowers individuals to protect themselves and others. This knowledge forms the bedrock of a safe working environment. By successfully completing this certificate in Bloodborne Pathogen course, you have demonstrated your commitment to workplace safety and public health. You are now equipped with the vital information and best practices required to minimize the risk of bloodborne pathogen transmission. Remember that safety is an ongoing commitment, requiring continuous vigilance and adherence to established protocols. Your certification signifies your readiness to apply these principles in your professional role, contributing to a safer environment for everyone. Congratulations on achieving this important certification, and continue to prioritize safety in all your endeavors.